Welcome to The Explainer. There's a question that might be on your mind, especially if you have an older parent, a loved one, or if you're even thinking about it for yourself. Are we taking too many medications? Today, we're going to look at 4 brand new studies that are really changing how doctors think about prescriptions for older adults.
Yeah, it's a massive question, isn't it? And it hits home for so many of us. As our loved ones get older, that list of prescriptions just seems to get longer and longer. I mean, it's not unusual to see a medicine cabinet just packed with bottles. And with every single new pill comes a whole new set of challenges and, yeah, potential risks.
Okay, so to really dig in here, we got to talk about a word you'll hear a lot: polypharmacy. It sounds all technical, but the idea is actually pretty simple. It's not just about taking a lot of pills, it's about what happens when all those different drugs start mixing together. It's about the bigger risk of side effects, everything from just feeling dizzy and falls to much more serious stuff.
All right, so here's our game plan for today. First, we're going to explore why this is such a tricky area of medicine in the first place. Then, we'll dive right into 4 really interesting recent studies. We're talking about blood pressure, bone health, antibiotics, and even a really common painkiller. And then, we'll wrap it all up with some real practical advice on what this all means for you and your family.
So, first up, the overprescription problem. You might be thinking, if we know that polypharmacy is an issue, why is it managing these medications as simple as just, following the instructions? Well, as we're about to see, the reality is a lot more complicated. A huge part of the problem comes down to this. We just don't have all the right data. Think about it. The very people who use these medications the most are often left out of the original research. Clinical trials frequently exclude older adults, especially if they have multiple health problems. And get this, the trials often don't even track the side effects that really matter to an older person's quality of life, things like falls or confusion. And to top it all off, most medical guidelines are built for a single disease, which just isn't the reality for so many seniors who are juggling several conditions at once. All right, let's get into our first case study. This one takes on one of the most common treatments on the planet: blood pressure medication.
So, researchers in England in the Optimized trial asked a really important question. They wanted to see if deprescribing, that's the careful process of reducing or even stopping medications, was a safe bet for older patients who already had their blood pressure under control. In other words, could we actually make someone healthier by taking a pill away?
So here's what they did. It was actually a pretty straightforward setup. They found a group of folks over 80 who were all taking at least 2 blood pressure drugs. They split them into 2 groups. One group had one of their medications carefully taken away, while the other group just kept doing what they were doing, usual care. And the result? Wow. Check this out. After 12 weeks, a staggering 86.4%, that's nearly 9 out of 10 people who stopped one of their meds, still had their blood pressure right where it needed to be. That's basically no different from the group that made no changes at all. Now, this shows that taking away a med is definitely possible, but it does have to be done carefully. About a third of the group did end up needing to restart their medication down the line.
Okay, next up, we've got a real classic medical dilemma. This one involves a super common type of drug for osteoporosis called a bisphosphonate. So here's the deal. On one side, you have these drugs that are amazing at preventing the common, often devastating fractures that come with weak bones. But on the other side, there's this little nagging worry, a concern that they might be linked to causing a very rare but very serious type of fracture in the thigh bone themselves.
So, a huge study looked at almost 200,000 women to get to the bottom of this. Now, this chart looks a bit intense, right? But here's the only thing you need to see. Anything far over to the right of that center line means there's a higher risk. And there's one that just jumps off the page. See that section for duration of bisphosphonates? The longer you use it, the further to the right that bar goes. That's our smoking gun.
Let's break that down. The numbers are pretty eye-opening. After taking these drugs for 8 years or more, the risk of this rare fracture was over 43 times higher. The study also found that women of Asian ancestry seem to have a higher risk. But, and this is a big but, there's some really good news here too. Stopping the drug was shown to bring that risk back down. So the bottom line is, for most people, the benefit of preventing those common fractures is still huge. But it's a risk that doctors really need to manage, especially if you've been on the drug for a long time. All right, let's switch gears to our third study. This one takes on a massive problem: antibiotic overuse, particularly in a place where people are really vulnerable: nursing homes.
The mission here was super important, but also super simple. How do we stop giving powerful antibiotics to nursing home residents for urinary symptoms when they might not even have a true infection? See, in older adults, it can be really tough to tell the difference, and a lot of times the default is to just prescribe antibiotics just in case. But that's a huge driver of antibiotic resistance.
And you know what's so cool about their approach? It wasn't some fancy, expensive new tech. Nope. It was all about education and good old-fashioned communication. They used simple things, webinars, little pocket cards with info, and monthly coaching calls to just empower the staff to make smarter, more confident decisions.
And did it work? Oh, yeah. The results were fantastic. The nursing homes that used this program saw a 27% drop in prescribing antibiotics when an infection was unlikely. And, this is absolutely crucial, it was done safely. There was no increase in hospitalizations or deaths.
But wait, there's more. The benefits didn't even stop there. Cutting back on unnecessary antibiotics had another huge positive side effect. It also brought down the rates of C. difficile infections. And that's a really nasty, sometimes deadly infection that can pop up after someone's been on antibiotics. And for our last case study, we're going to look at a painkiller that a lot of us think of as a safer option, Tramadol. So, a big study in the UK put two common painkillers head-to-head, Tramadol and codeine. They wanted to see if one had a higher risk of hip fractures in the people who took them. So, who do you think was the riskier one?
The answer was pretty shocking for a lot of people. Taking Tramadol was linked to a 28% higher risk of a hip fracture compared to codeine. It's just a powerful reminder that safer doesn't mean zero risk, and every single prescription has to be weighed carefully for each individual person.
Okay, so we've just gone through 4 really different studies. What does all this research actually mean for you or your family? How do we put this into practice? The single biggest takeaway from all of this is that you have to be an advocate. Be the CEO of your own health, or for your loved ones. The next time you're at the doctor's, it's time to have a conversation. You can use these questions right here as a guide. Think of it as your own personal medication checkup to make sure every single prescription is still doing more good than harm. You know, when you look at all these studies together, they're all pointing to the same big idea. As we all live longer, medicine just can't be one size fits all. The best care for older adults means moving beyond just treating symptoms or numbers on a chart. It's about moving toward a really personal approach that carefully weighs the risks and benefits for each and every person. That conversation, well, that's where it all starts. And it starts with you.